I'm a cardiothoracic surgeon, meaning I do operations within the chest, and my particular specialty is operating on children's hearts. The difference between a surgeon and a cardiologist is the cardiologist is a physician, or in Dr. Dama's case, a pediatrician, who is trained in studying the heart, usually through things like echocardiography, so being able to image the heart, being able to look at the structures of the heart and making a diagnosis, and being involved in treating the heart with non-surgical means. So, for example, using catheter interventions or things like your listeners may be familiar with stents or those type of interventions. So that's what cardiologists do. There are some of the holes in the heart that can be treated in that way without an actual open heart surgery. When it comes to the more complex conditions that need surgery, that's when Dr. Dama would refer a patient for open heart surgery, and that's the actual operation as most people would understand it.
I see. Just moving to the WhatsApps quickly, two questions.
Cardiothoracic surgery is quite limited within South Africa. Unfortunately, the vast majority of cardiothoracic surgeons do adult cardiac surgery. So that's things like bypasses and valve replacements, which we all do. But there are very few of us that operate on children. There are about six in the country that are predominantly operating on children. That's two specialists in Cape Town, two specialists in Johannesburg, and there are two of us in Durban that are doing it. So we are a highly specialized surgical field. Um, and within Durban, Lene Titikweni is the only hospital that offers pediatric cardiac surgical services. At our congenital heart center, we have a full pediatric cardiac theater with an intensive care unit, and we have a cath lab which is capable of doing interventional procedures on pediatric patients.
I see. And just going back to the first question, where they ask, why is there a high fatality rate among neonates?
So newborn babies, as we mentioned, often the fact that they present in the newborn period usually tells us that there's something quite severely wrong with the heart. And when children need operations in the first month of life, we're not just dealing with the fact that we've got a child with a complicated heart condition, but we're also dealing with the fact that they are newborn babies. So neonates are prone to other things like infections, prematurity, underdevelopment of their organ systems, and children with cardiac defects unfortunately also have other defects associated with it. So all of those add up and can increase the mortality or the risk of the surgery. Having said that, provided that most children are diagnosed early and they referred to us early, most neonatal cardiac conditions today have a very low mortality, provided it's done in a center such as our center where you have all the facilities.